Good morning. I'm CEO Dr. Mark Laney, speaking from Mosaic. We wanted to give you a brief update today regarding our COVID circumstances and situation. I'm sure you've seen news across the country that really everywhere there is an increased number of COVID cases and hospitals are full and busy. So let me give you the latest update regarding our COVID inpatients. We have 75 patients that are currently in isolation. 67 are in St. Joseph, 5 in Maryville, 3 in Albany. 7 of those patients are in our intensive care unit. 4 of them are on ventilators. And we have today 87 caregivers that are out on medical leave with COVID. So if you add in our current patients in isolation, plus those that have been with us for more than 10 days and are out of isolation, we have 90 to 100 patients total. That's about a third of our inpatient census across the system. Currently, our testing update, our 7-day positivity rate is 41.52%. So 41% of the tests that are done end up being positive for COVID, which is very, very high. Buchanan County Health Department has had a very busy week. In addition, they had 205 COVID patients on Wednesday and 257 Thursday. So we are indeed across our county and our area in a very high positivity rate. We have had a tremendous number of urgent care patients and have added additional resources and are adding some additional hours, hopefully, to urgent care to be able to maintain that. Our respiratory clinic on the north side of our campus is now open, and we are accepting Mosaic and non-Mosaic patients that are referred by their provider to have a rapid COVID test done to help offload our urgent care and our emergency room and our clinics. And I believe that they did almost 100 tests yesterday, so very, very, very busy. We do continue to do surgeries at Mosaic. We have a team of surgeons and anesthesiologists that review the cases for their appropriateness on a frequent basis, and it is the decision of those physicians on which cases should go forward and which cases, if any, should be delayed. But we have frontline physicians, surgeons, and anesthesiologists making those decisions. We are not recommending at this time completely stopping surgeries. As I noted before, 2/3 of the patients in the hospital are not COVID patients. And there's pain and suffering that continues, and we have to deal with not only COVID patients, but also all the other problems. And we do so with the safety and the well-being of our patients first and foremost. You may have heard that recently, several days ago, we reactivated our hospital incident command system. This is an internal tool that we use when we have a highly specified or intense circumstance. More than a year ago, that incident command system, when we were first learning to deal with COVID, was actually up for several months. And it is a method by which we bring information in from all the different resources, we evaluate it, we create action plans, and then are able to, in a more comprehensive manner, distribute that action plan out to all of our sources and all of our caregivers. And It's something that we would use in a tornado. It's something that we might use in a mass casualty incident. Because of the heightened number of COVID patients, it seemed very reasonable for us to reactivate that. It's something that we do multiple times every year, not just with COVID, and we find it a very effective way to make sure we're efficiently managing all of our access points, all of our caregiver needs, and all of our patient needs. So it doesn't mean that we are in a dire crisis, but we find it an effective tool to manage stressful circumstances, shall we say. So we are still asking all of our friends and patients and families out there to help us where they can. Internally, we have caregivers volunteering to work in different parts of the hospital that they normally don't work to fill in. We are a family, and we're working together to optimize your care. Don't be surprised if you come to the emergency room that you're going to wait a longer period of time because of the number of COVID patients that we're dealing with. We have a very high inpatient census, and so it's unlike normal times where we would have open beds and we could move you through. So be aware of that. However, I would also say, if you're having chest pain, if you're having stroke-like symptoms, you need to still come to the hospital. We will and can take care of you. That is something that should not be delayed. If you have the sniffles and you need a COVID test, then we've got other options for you. But if you're having a very significant symptom, please do not defer your care. We are still here for you. We do expect this peak time to last for probably several more weeks. And then we are hopeful, and national experts are hopeful that the number of new COVID cases, the Omicron cases, will diminish. But until that time, same old story. You're going to hear it from me every time you probably see me. We want you to wash your hands. We want you to wear a mask if you're out and about. I was in the grocery store the other day. I was proudly wearing my mask. And we want you to, do social distancing where appropriate, and just be thoughtful, especially over the next several weeks. You've read about breakthrough cases. This is not unexpected. The virus continues to mutate, but what we would say is those folks that have been immunized have much less symptoms, far fewer hospitalizations, and are much less likely to end up in the intensive care unit than those that have not. So be smart and be safe. And I want to thank all of our caregivers also in Albany and Maryville that continue to work with us on a daily basis as we move patients back and forth to create capacity for the sickest patients here in St. Joseph. So that's all for now. We plan on giving weekly updates once or twice a week as we go through this high-intensity part of our COVID season. And with that, good day and be safe.
Let's answer some questions.
And now we'll do some questions.
You mentioned the incident command system being brought back. You talked about that being something done internally, but what does that actually change, and kind of how does that change the operation, and what differences are there?
It doesn't fundamentally change what we do, but it provides a forum, a place where all the information can come in and go out so that we can coordinate care. If we didn't have that, if everybody's having to go to different offices and check with different people and we don't have set meeting times, you can imagine that that's kind of clunky. So this streamlines things. It makes it tighter. It makes it far less likely for us to not all be on the same page at the same time. So it's a tool for efficiency, and for communication internally, for us to communicate with each other. There's so many moving parts. I mean, it's hard for you probably to imagine how difficult it is just to set up a respiratory clinic and how many people are involved. But it's our way of making sure we're at our top performance level.
Is there ever going to be a situation or chance, or is there planning for a time where maybe certain services will have to be cut in order for that staff to be used in a pandemic COVID situation?
Yes, and we already have been using, to a small degree at this point, caregivers in our outpatient clinics who have volunteered to come into the hospital and lend a helping hand. These people are all qualified in the areas that they're working, but we can first do more virtual outpatient visits and use that staff in the hospital. Second, we can streamline some services that are not necessarily essential if we were in a really difficult circumstance. But we are not there yet. But we have a plan A, a plan B, and a plan C, rest assured, and so that we are able to continue to care for everybody that needs our care in our region. That is our goal. That is why we're here, and we want to be here for you, but we also need everyone to understand we are super, super busy. And because of that, there's going to be some increased wait times. There's going to be some inconveniences. And it is what it is. And we would just hope that people would understand and continue to be kind and supportive of our caregivers.
Well, there's been some shortages of testing kits. Has Mosaic experienced any shortages on kits or being able to test everybody that wants to test?
We're still in good shape regarding testing. Sean Polance, who's our vice president over supply chain, has just done a heroic job over the last 2 years. We are short, are going to be short regarding some therapies, some infusion therapies, but those are things that we receive from the state and have no control over. The good thing is that if you're going to be short when you don't need as much, and the Omicron variant doesn't respond as well to some of the IV infusions that we've used previously. Some people think that's a blessing, and that if Omicron, and it is very, very virulent, but not as serious, that we could have more herd immunity by people having no symptoms or cold-like symptoms, and that yet they would still gain immunity against coronavirus. So, long answer, we're in good shape.
You talked a little bit about those antibodies from the state, those infusion treatments. Do you feel like, as of now, that the state is providing adequate support to the hospital, and do you think that there could be more support received from the state?
That's a great question. I think we're okay relative to the medications, given the current circumstance. I do think that the state's approach relative to the emergency circumstances and the waivers, doing away with that was, in my opinion, a bit too soon. Some of those waivers are really helpful in us having reduced barriers to providing care and flexibility, but that's not my role. But in regards to the governor being supportive and concerned, we appreciate him. He's been very good to St. Joseph, and we appreciate all of our state representatives continuing to be aware that this is a very big deal for us. We are not in the free and clear circumstance of COVID. We're still out fighting like a team every day, and we just continue to ask for their support.
And just going back to some of the staffing numbers that you talked about, that's something, hospitals across the state are talking about, is just the difficulty with staffing. You have 87 out sick for COVID. How many do you have out sick total? What's kind of staffing like right now?
Staffing is tight. I would guess that staffing's tight across the metro area. I'm not aware of how many additional patients or caregivers we have out. This is actually an improvement. A week ago we had almost 100. So the other thing I would say is yesterday the Supreme Court ruled that as far as the Center for Medicare and Medicaid Services, that they do have the legal authority to mandate vaccinations of healthcare workers, hospitals. This is consistent with what we have been talking about. It's consistent with the actions. Our main reason in mandating was to make sure that we provide the best and safest care to our patients. CMS is given authority over hospitals to ensure safety of patients, and that is why the mandate held on the healthcare side. We have already kind of worked through that process, thinking and believing that on the healthcare side, CMS would prevail, and in fact, that is what has been done. So we're pleased with our own actions. We feel like we've done the right and moral thing, and that has been vindicated by the Supreme Court.
I did want to ask you what your reaction was to the Supreme Court. A lot of people talked about a split ruling, but what was your reaction to the Supreme Court ruling?
I was supportive on the healthcare side because I believe it is the right and moral thing to do. We require all kinds of vaccinations for all of our new caregivers. We require tuberculosis tests. There's a whole slew of things that we test new caregivers for. It only makes sense that we would require COVID immunizations. I'm not surprised at all that it was overturned on the OSHA business side of things. That was probably a bit too stretchy for many folks, and probably was considered a burden, especially to small business.
But you thought the CMS rule would be...
Absolutely, yes.
When talking about staffing, what also is Mosaic's awareness for, obviously, nurse burnout being a very important factor, and just another wave of COVID, just the maybe emotional and, I guess, burden that provides to these people who have been on the front line since the very beginning.
It's real. You've read about in the national news the phrase, the Great Resignation, where people from all different careers have had experiences where they've decided, life is too short. Maybe I should go ahead and retire. Maybe I should do something different. And take that and multiply it by 1,000, and you have healthcare workers. I mean, we have people who've been fighting for 2 years. Can you imagine being deployed in the military for 2 years and being in stressful circumstances each and every day? Well, that's what we've done with healthcare. And it's affecting nurses. It's affecting physicians. There is a great wave of resignation happening right now at the executive level. This is a complete stressor. And so we are aware of it. We are trying with our human resources group, our talent agency, to lift people up, to give them little breaks, to give them little positives. Today is a blue jean and Chief. I've got my Chiefs sweatshirt. Was wearing that. we're doing little things to say, we love you, we appreciate you, let's go, they need us, and there's been tremendous teamwork of people helping each other. The stories that we have to share regarding that, it's just amazing. And so I'm riding on the wave of the goodwill and the courage of all the people that I work with, who, despite very stressful circumstances, they're giving it their all. But we can't do this forever. It's been 2 years. 2 years is a very long time. Our census is, probably 50 or 60 patients above what we would normally have this time of year. And it weighs on people. It weighs on them. It weighs on their children. It weighs on their spouse and their families. So, but we're hanging tough, and we're going to get through it.
Anything else? Okay.
Thank y'all for coming today.